Back to Israel now. The World Health Organization has issued a warning about an alarming state of the health system in Gaza. You've been seeing some images of this, likely on social media, saying that this area, this region, is on the brink of collapse. The group is calling for immediate humanitarian relief and adherence to international law to protect civilians in the region. Tarik Jasarevic, spokesperson for the World Health Organization, is with us now. Thank you for your time. Please paint a picture for us, although we have seen some inside of Gaza, what day-to-day life is like for civilians who are being shuffled around amidst the fighting.
Well, it's really a humanitarian disaster zone, as it has been explained by our colleagues who visited Al-Ahli hospital. That's only remaining partially functioning hospital in the north of Gaza. Bed capacity is already at 300%. People are on the floor, not being able to receive care. There is no more health care workers in the same numbers as before. There are amputations being done because there is no vascular surgery capacity. There are no orthopedic surgeons. There's a lack of oxygen. There is a lack of supplies. There's also a lack of water and food for patients and for health workers. And on top of that, you have all these people who are looking for shelter in hospitals, hoping that this will be a safe area. Unfortunately, this is not really the case. We verified in many instances more than 400 attacks on healthcare in Gaza, and we just witnessed very distressing scenes when health workers who were with us going to Al-Ahli hospital were taken and detained by Israeli army and later told us about inhumane treatment they were subjected to. So the situation is there's a less health capacity on the ground. Only 11 hospitals out of 36 are partially functioning, and there is more and more health needs. More and more people are being injured in bombardment. There are people with chronic conditions, pregnant women who can't access healthcare. And on top of all of that, there is a risk of infectious diseases.
What about the aid? There has been some aid that has gotten in. I know it's not nearly enough. And what can you share about reports that Hamas is intercepting that aid?
Well, we are doing the best we can together with other humanitarian agencies, UN agencies, but also non-governmental organizations, to bring in as much supplies as possible. We need security for that. We need to be able to safely get to hospitals. And I was just describing one incident where there are lots of military checkpoints that's delaying the operations that we are trying to do. And the World Health Organization and its executive board adopted a resolution last Sunday calling for respect of humanitarian law when it comes to protection of health facilities, but also calling for humanitarian aid to get safely in, including medical supplies. So we need humanitarian space to be able to bring supplies where they are needed, and not only medical supplies, water, fuel, all the other things that people are needing right now. So the situation is really desperate. The only solution is end of hostilities, so we can do our job, and people of Gaza can access again health services.
Well, end of hostilities. I mean, this could go on for a month. I know that that's difficult to see that happening anytime soon. Given that, and the WHO responds to disasters all over the world and health crises, how does this compare to anything you and your colleagues have ever seen?
Well, our head of office for the occupied Palestinian territory was saying just this morning that it's something that he has never seen before while he has been in many emergency situations. We really need to continue pleading really for hospitals to be spared. We cannot lose more hospitals. Hospitals have to be protected. Health workers cannot be targeted.
All right.
Ambulances cannot be shut at.
Unfortunately, Tarik, I'm out of time, but your message is clear. More help is needed, and it's needed now. Thank you for your time and for the work that you and your colleagues are doing. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.